The A1C test is a common blood test used to diagnose type 1 and type 2 diabetes. If you're living with diabetes, the test is also used to monitor how well you're managing blood sugar levels. The A1C test is also called the glycated hemoglobin, glycosylated hemoglobin, hemoglobin A1C, or HbA1c test. An A1C test result reflects your average blood sugar level for the past 2 to 3 months. Specifically, the A1C test measures what percentage of hemoglobin proteins in your blood are coated with sugar, glycated. Hemoglobin proteins in red blood cells transport oxygen. The higher your A1C level is, the poorer your blood sugar control and the higher your risk of diabetes complications. The results of an A1C test can help your doctor or other healthcare provider diagnose prediabetes, diagnose type 1 and type 2 diabetes, monitor your diabetes treatment plan. For example, the A1C test may be recommended once every year if you have prediabetes. The A1C test is a simple blood test. You don't need to fast for the A1C test, so you can eat and drink normally before the test. During the A1C test, a member of your healthcare team takes a blood sample by inserting a needle into a vein in your arm or pricking your fingertip with a small, pointed lancet. If the blood is taken from a vein, the blood sample is sent to a lab for analysis. Blood from a finger prick may be analyzed in your doctor's office for same-day results. This in-office test is only used for monitoring your treatment plan, not for diagnosis or screening. A1C test results are reported as a percentage. A higher A1C percentage corresponds to higher average blood sugar levels. Results for a diagnosis are interpreted as follows: below 5.7% is normal. 5.7% to 6.4% is diagnosed as prediabetes. 6.5% or higher on 2 separate tests indicates diabetes. For most adults living with diabetes, an A1C level of less than 7% is a common treatment target. Lower or higher targets may be appropriate for some people. The target of less than 7% is associated with a lower risk of diabetes-related complications. If your A1C level is above your target, your doctor may recommend an adjustment in your diabetes treatment plan. A part of your treatment plan will include self-monitoring at home with a blood glucose meter or other device. Your healthcare team will direct you on how often and when you should test your blood sugar. The measurement shows your blood sugar level at the time you do the test. For example, if your A1C target is below 7%, your self-monitoring blood sugar levels should be, on average, below 154 mg dl, 8.6 mol L. Some factors may interfere with the accuracy of A1C test results. These include pregnancy, recent or heavy blood loss, recent blood transfusion, conditions that result in insufficient red blood cells, anemias, hemoglobin variants. The most common form of the oxygen-transporting hemoglobin protein is called hemoglobin A. The presence of other variants of the protein may result in inaccurate A1C test results. Hemoglobin variants are more common among people of African, Mediterranean, or Southeast Asian descent. If you have a hemoglobin variant, your test may need to be sent to a specialized lab, or you may need a different test for diagnosis and monitoring of diabetes. Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.